logically linked cases, bringing our total number of people diagnosed with COVID-19 to 78,673 in British Columbia. And of those, 86 were in the Vancouver Coastal Health Region, 207 people reside in the Fraser Health Region, 37 people on Vancouver Island Health Region, 24 people in the Interior Health Region, and 41 people in Northern Health. That leaves us with 4,489 active cases right now, of whom 228 people are in hospital, 62 in critical care or ICU. We also have 79,031 people under active public health monitoring and 72,781 people who are fully recovered. Tragically, over the last day, we have had 10 new deaths related to COVID-19, bringing the total number of people who've died from COVID-19 in British Columbia to 1,348. And our condolences go out to each of the families, their care providers and communities who we know are mourning their loss. Our thoughts are with you as well during this difficult time. We do have one additional healthcare outbreak in the Riviera Sunwood Retirement Community, an independent living community. And the outbreak at the Burnaby Hospital is now finally declared over. So that leaves us with 13 active outbreaks in long-term care or assisted living or independent living, and 5 in acute care, and involving 398 residents and 213 staff. Although thankfully, we know that those new cases in our long-term care homes in particular have dropped dramatically. Since the start of our immunization program, we've now provided 239,833 doses of COVID-19 vaccines across British Columbia. Of those, 68,157 doses were to people who received their second dose. And we have seen that the vaccines we have available today are doing their job. The effectiveness has been proven, and I mentioned the research that we've done through the BC Centre for Disease Control that we released last week, showing how effective it has been in preventing transmission in long-term care and in healthcare workers. We've also seen that confidence is high in our immunization programs, and we've seen that providing the information people need to make that informed decision about receiving the vaccine is working. And we know there are many, many people in BC who are eager to get vaccinated as quickly as possible. And right across Canada, I can't stress enough how much we are working together. My colleagues in the provinces, the territories, our federal government, our health workers who are working at our National Operations Centre, all of us are doing what we can to make sure we can get vaccine to everybody in Canada as quickly as possible. I am encouraged immensely by the enthusiasm, but I also ask that give us the time to make sure we're getting it right. We have not been idle these last few weeks when we've had limited doses of vaccine. We have putting together the building blocks to make sure that we can be as efficient as possible and minimize those inevitable bumps and hurdles that we are going to see along the way as we continue to ramp up and get ready for our mass clinics. And we are starting, as you know, with our most vulnerable seniors and elders in our communities across BC. And we'll be starting, as Minister Dix has said, Dr. Ballum and he and I will be presenting you those details on Monday. But rest assured, things are ramping up and we will be providing vaccine very shortly. The other consideration, of course, that we've had as we've had this vaccine hope is managing the pandemic that we are dealing with right now here in BC. Part of that is our ongoing surveillance and management of the variants of concern to see how they are affecting our communities. There have now been 16 new confirmed COVID-19 cases that are these variants of concern since our last report, making our total number that we've found in our surveillance 116 cases. Of these total, though, only 9 are currently active, and the remaining are people who've been through their infectious period. So we have to date 95 of the B117, initially associated with the UK, and 21 people who've had the B131, the South African variant. I will also say that I mentioned last week that we had an initial case of a variant under investigation that has been associated with Nigeria. We've had a second case we reported on earlier of that, but these have been reviewed, and when we talk about variants of concern, what we're concerned about is, can they transmit more easily, cause more severe disease? And so we are still monitoring the one associated with Nigeria. So it's called a variant under investigation, and we'll just be keeping that one on side and watching it carefully. Of the confirmed VOCs that we've had, 71 were in the Fraser Health region, 39 in Vancouver Coastal, and then we had 4 in Island Health and 2 people in the Interior Health region earlier on. And I understand that lots of people have questions about what these mean for our province, our communities, and also for the restrictions that we have in place. And I know there's been modeling, there's been lots of concern. I will tell you that across the province, we are paying special attention to people who are infected with these variants so that we do better understand the transmission patterns and the impact they're having on our pandemic and our communities here in BC. This in turn helps inform any changes that we may need to make. So health authorities are following up actively, as we have been doing with every case, but making sure we collect extra information on these particular variants. Right now, about a quarter of them, we are unclear where they acquired these infections, and those that has remained relatively stable. And we talked as well last week about doing what we call a screening test on the first, once somebody is positive on a PCR test, we now have a screening test that can detect whether it's likely to have one of these variants of concern. And we are able now to do that in about 75–80% of all of the positive tests every day. And by the end of next week, that'll be up to 100% of our testing. The other thing that is important is that all of the evidence has shown us that the things that we do to prevent transmission work against these variants as well. And that is why we all have to continue to do what we're doing. The precautions we take are equally effective against these variants as they are against the other strains of the virus that we have been dealing with. And just to give you an update, one of the things that we have been doing is paying special attention to when we see people who are infected with these variants in some of our more concerning environments, particularly schools. And as you know, over the weekend, there were 7 historical cases of people who had been infected with variants that were identified in schools, in 7 schools in the Fraser Health region. And Fraser Health has undergone a testing program to make sure that we can see if there was transmission from any of these cases in the school system. Right now, they have, as of today, they've completed 83 people have had a point of care test. So those were people who it would affect their management to know right away. And 201 people have had PCR tests. Of those, 6 people at 2 schools have tested positive. We do not yet know, so that's 5 students and 1 staff person at 2 of these schools, at Surrey Traditional and at Woodward Hill. We don't yet know if those new cases are these variants of concern or not. It takes some time to do that whole genome sequencing. So Fraser Health is continuing to work with the Surrey School Board and to do that additional testing, and we'll have more information as the investigation continues. Over the last month, we have been closely monitoring our new cases and our rates of transmission so that we can better understand when we can safely open up or whether we need to take additional measures in terms of our public health restrictions and orders. The 7-day moving average is one of the measures that we use to help understand what's happening over time. Our daily numbers, as you know, can fluctuate depending on testing levels, etc. So we look at things like the 7-day moving average, And what we have seen in the last 2 weeks is that has come up a little bit here in British Columbia. And we also look at our percent positive of the tests that are done every day and the 7-day rolling average of that. And that has also crept up a little bit to about 6.7% of our tests are positive. It's not the same across the province, however, and we know that in the Lower Mainland in particular is where we've seen most of this uptick. And the percent positive of people who are tested in the Fraser Health region is about 8%, so above our average, and it's about 11.5% in the north. Also concerning for us because we need to monitor exactly who and where transmission is happening. The other value that we look at, and it's what we present monthly in our modeling, but we look at it on a weekly basis as well, is what we call the reproductive number. And we had been nicely trending down around the province. In the last 2 weeks, we started to see that move above the level of 1. And what that means is that there's potential for rapid growth if we're not careful. Again, it has varied around the province. We know that this is most important, or where we're seeing most of this change, is in the Lower Mainland, in the Fraser Health and Vancouver Coastal Health region. So this tells us that every person, on average, who's infected is spreading to more than one other person. This is something that we need to watch and be careful. It's like a tree that keeps growing and spreading. But we need to keep cases low and slow so that we can control that. We are continuing to watch these indicators, and when we have confidence that they are slowing in a sustained way, that is when we'll be able to ease restrictions. But we are not quite there yet. We are looking ahead into March to make sure we know when we can increase our social interactions in a limited way, when we can have safe in-person religious services again, or safely increase things like youth sports to provide those opportunities for as much needed opportunities for connection and for health. We're all keen to get to that point where we can safely spend time with more of our family and our friends, when we can travel, at least within BC, and resume some of those things that we have all put on hold for these long winter months. But with that fatigue, sometimes we know comes frustration and challenges. Yesterday was Pink Shirt Day, and we spoke about the need for kindness and compassion with each other. That's something that we have talked about throughout this pandemic. And as we come on to a year, it is more relevant than ever. Supporting the store clerk when they remind you about their COVID safety plan, following the requests of the server in the restaurant when they ask for your information for contact tracing, or remind you to put on your mask when you're moving about the rest, that keep us safe. These are the key things that keep businesses open, keep our restaurants open, our retailers open. And keeping businesses safely open is important for many reasons, not just the economy, but we know that the consequences of unemployment, of having these businesses in our communities closed, has effects on our health and well-being as well, especially for young people and families. And this is why we all need to do our part to follow the safety plan so that we can continue to keep things operating, to keep things open safely for our communities. It is, as always, our individual actions that make a difference collectively for our communities, our families across the province. And we know that this works. As we have this whole ramping up of our immunization program and the hope that in the next few weeks we will be in a different place. We all need to remind ourselves that we're in this together, but we're not all in the same boat. And it is kindness and compassion that will see us through this pandemic again. I ask you please to remember to be kind and to be calm and to stay safe.
Thank you very much, Dr. Henry, and I want to start by extending my condolences to the families, friends, the caregivers of the 10 people who passed away from COVID-19 in the last 24 hours, 5 in the Interior Health Authority, 1 in Northern Health, 1 in the Vancouver Coastal Health Authority, and 3 in Fraser Health. It's an extraordinary time, I think. We've noted this all along, that it is a moment of sadness in everyone's life. We know that at the moment, for example, people will have memorial services, funeral services with 7, 8, 9 people, where ordinarily you would expect hundreds. It is a difficult time to grieve, and we have to all find ways to support ones who have lost loved ones, both in this public health emergency of COVID-19, in the overdose public health emergency, and are dealing with other health issues and have passed away during this pandemic. Even if it's not connected to a public health emergency, it is a hard time, and we are thinking of you and have you in our hearts. I wanted to note that we have released again this week and posted, I think it's posted now on the CDC website, the weekly Outbreak report on long-term care, assisted living, and independent living. It's based on numbers Tuesday to Tuesday, as you'll see in the report, and therefore there was 1 care home outbreak in the Interior Health Authority that was declared over yesterday that's still in this report. But of the 11 long-term care home outbreaks, 9 of them had no new cases this week. So it's not just a question of the very significant reduction in long-term care outbreaks, but the fact that the ones that we have, the outbreaks that we have in long-term care at present are stable and are not seeing new cases. This is extraordinarily good news. And I want to again pay tribute to our teams of public health officials and people in long-term care as well, who have organized immunization campaigns. 65,720 residents and staff have been immunized with 1 dose, and 37,400 have been immunized with 2 doses of COVID-19 vaccines. In addition to that, 5,424 essential visitors have received 1 dose, and of those, 1,382 have received both doses. We see the impact of that, and it is heartening, and it has made a huge difference for everyone. You'll also note that we did 9,000. Yesterday, the system did 9,008 immunizations, the majority of which are second doses, reflecting where we stand right now in terms of supply. That supply is getting better, as you know, but we are continuing at the moment to do second doses, and the majority of the doses done yesterday were in fact second doses. Wanted to note, we also publish regularly information on local health areas, and I just wanted to note that what we saw in the post-Christmas period was an increase, and a significant increase in cases in the Interior Health Authority at times, both in cases and in hospitalizations. And we've seen that come down in terms of active cases, in terms of the number of daily cases we've seen in the Interior Health Authority. And it shows again what we can do together as communities. And I think there is a significant number of people, and 5 of the people who passed away were in Interior Health today, and we still have more than 20 people in hospital in Interior Health. All of that is true, but it also shows that when we act together as communities, we can reduce transmission. And Interior Health has shown that in the last couple of weeks, and I wanted to acknowledge that. On Thursday, we also update you on the surgical renewal commitment. Since May 18th, we've delivered more than surgeries to more than 90% of those who had surgeries postponed due to COVID-19. As well, we continue to schedule and deliver surgeries that were not scheduled due to the pandemic, and to change the way we deliver surgeries in BC to better meet the needs of those who will be identified as needing surgery in the future. Since May 18th, when we launched this initiative, and the Premier launched the initiative, 70,352 surgeries completed in Fraser Health, 47,723 in Interior Health, 14,656 in Northern Health, 61,191 in Vancouver Coastal Health, 53,513 on Vancouver Island, and 10,349 in the Provincial Health Services Authority. For the week of February 8th to 14th, we have the verified number of surgeries is 7,324, which is 196 more surgeries than the same week last year. And I want to thank everybody involved. Those numbers are exceptional, especially considering the fact that COVID-19 does cause surgeries, and safety precautions do cause individual surgeries to take longer. It shows the commitment of healthcare workers, from people involved in registration and booking to surgeons and surgical nurses and health sciences professionals right through our system, and their extraordinary commitment and dedication, and I want to thank them as well today. In closing, I think we know this, that we have another weekend coming up ahead of us after tomorrow, and it continues to be our duty to stop the spread, especially now. The variants of concern mean we won't vary and cannot vary our use of the skills we know to keep us safe. And we know that throughout our BC effort, our hard work and determination have turned uncertainty into confidence, transformed hope into reality, and converted promise into achievement. We've shown that we can achieve when we're 100% all in, when we stay 100% committed to our role. So this weekend, let's stick to doing what stops the spread. Let's stick with what we know keeps people safe. Stick together in our shared effort for the ones we love and the ones we don't know, fellow members of our communities. Aujourd'hui, nous annonçons 395 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 78 673 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 10 nouveaux décès liés au COVID-19 pour un total de 1348 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 228 personnes sont actuellement hospitalisées, dont 62 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press star 1 to enter the queue. You'll be limited to one question and one follow-up only. I would also ask that you please remove yourself from mute. You will not be audible until your name is called. First question this afternoon is from Mary Griffin, Check News.
Very much for taking my question. I'm just interested in when you were talking about the reproductive number, Dr. Henry. I was speaking with Dr. Richard Stanwyck earlier today, and he was saying that they are finding 1 out of every 5 positive case, they don't know where the origin of the virus is coming from. So 20% of people there is no explanation for where they contracted the disease. And I'm just wondering, do you have a reproductive number for the island, and what are your concerns about when you hear that up to 20% of the cases can't be tracked back?
So that is something that we've been watching from the very beginning, and it's if you look at the BC CDC weekly report that's posted, one of the epidemiologic curves that we have is about the numbers of unlinked cases essentially in our community, and that has held steady around 20%. And that is a reflection that this virus is circulating in our communities around the province. And we've often said, it's not the cases we know about that are the issue, it's the ones we don't know about. And sometimes we can't make those links. It is just a reminder to us that this virus is transmitted by people. And when we come together, sometimes we don't recognize or we don't realize that we have had contacts and that we are able to spread it to others. So it's a reflection, as Dr. Stanwyck was saying, that it is circulating, it is in our communities, and we need to take those measures to prevent those infectious contacts, those contacts where we can potentially transmit it to others. So that is, that is what we have been reflecting all along in this. We do have modeling that we do on a weekly basis for all regions, and the reproductive number in the Island Health Region, the numbers are very low, so it's not what we call a stable number, but it is just under 1 last time I looked at it. We only look at it about once a week because it's not something that changes cases on a daily basis. But in the last couple of weeks, we've seen a decrease in the interior, and Mr. Dix reflected on that. We've seen a decrease in island health, and it's sort of leveled off in the north, but we've had an uptick again, mostly in the lower mainland.
Mary, do you have a follow-up?
I sure do. Thanks so much. It's kind of a two-parter, so my apologies in advance. I was just wondering, you had mentioned that you'd be looking at March before lifting any restrictions. What are you looking for to before that would occur? And number two, an epidemiologist on Twitter today, or last night rather, compared BC to Florida in terms of its mask mandate, and I was just looking for your reaction to that.
Compared to the mask mandate, I'm not sure that I can reflect on that at all. I mean, I think in some ways we're the Florida of Canada in that we have milder winters, but I don't think in terms of our pandemic that we have many comparisons with Florida, so I'm not sure what that refers to. I'm sorry, and your first question was around... What would it take? And it really is looking at risk in our communities. And we know that this virus, as I said, is transmitted between people. So what are the situations, and the measures that we've taken have addressed those situations where we know that risk goes up. So there was a couple of things that happened in October, November. We recognized that this virus transmits more easily in the winter weather, and it has to do with humidity and the ability of the virus to survive. Plus, we also have had concerns about these variants because we've seen in other countries that they can transmit more easily. So those two things coming together made us very concerned, and we're now getting a better sense of how many people are infected with these variants, how it's being transmitted in our communities, although we are not yet at the point where we are able to screen 100% every day. So we are still seeing increasing numbers, but not rapidly increasing. So that's important. So we need to have a little bit more stability in that measure. We also need to understand, as we head into spring, are we going to see that seasonal decrease in infectivity or an ability to transmit? That will help us as well. And, of course, making sure that we have our vaccine program back on track so we can protect those who are most at risk of getting severe illness. So it's lots of things, but really what I'm looking at is what the team is looking at is the reproductive number, our 7-day rolling average, the scenarios where we're seeing transmission happening, and our ability to do the contact tracing to manage those cases, and where our measures have been put in place to reduce the more risky environments, which are indoors, crowded environments where we're not wearing masks necessarily, and when we are speaking loudly or close to others and singing or working out heavily, those types of environments where the risk of spread is much greater. That answer your question?
Next question is from Justine Hunter, Globe and Mail.
Thank you. I guess, first of all, can you talk about what in general is driving the spread of COVID in BC right now? You were just talking about scenarios. Is it generally people not following the rules, or is it spreading in workplaces or other places despite the rules that are in place?
It's a combination. So in the interior health region in particular, we know that a lot of the transmission was from social events that were happening. We know that some of the transmission has been from religious services where people have and we know the challenge that comes with having not having a connection with people for a long time, where people have gone to a service and then gone back to other communities and unwittingly spread the virus in those communities, and that unfortunately has been the case in a number of places, particularly in the north. We are also seeing a proportion, about 40% of the cases related to workplace transmissions. And it's not the public-facing interactions necessarily. Some of those are happening. We've seen cases in where restaurant patrons are getting together, and people who are positive are spreading it to others in that situation when the rules are not being followed. And that is a challenge. We're also seeing it in some of the high-risk workplaces, like we had recently another food processing facility where there is a combination of issues around people recognizing that they're ill, around having the ability to stay off work, and that speaks to things like staff shortages, but also sick leave policies and ability for people to have the protective equipment they need. And also we are seeing, we have a task group that has been looking at how do we work with WorkSafe and our environmental health inspectors in some of the more high-risk work environments to reinforce the safety plans that need to be in place and look at if we need to make changes. So they've identified, and we've talked about this a little bit before, that there are specific times where things can lapse. Sometimes it's related to lunchrooms or break rooms where there's not a staggered break time and people are taking their masks off and spending that time together. So there are a number of different factors, but the bottom line really is it's about connections between people that are done when we don't have the right safety measures in place.
Christine, do you have a follow-up?
Yes, please. We know that the elderly and long-term care have accounted for the majority of deaths over the past year due to COVID, but what can you say now in general? What are we seeing in terms of a trend about who is most at risk of serious health consequences or even of dying right now?
Yeah, and you know, that is one of the biggest challenges, of course, is long-term care, and this is why we are so relieved and thankful that the vaccines are so effective. What we are seeing now is most of the deaths are occurring in acute care facilities and some of the acute care outbreaks, and they are mostly driven by people who are older. So people who are living in the community who become infected, whether through family members, through social interactions, through work. But we also are seeing some younger people, and particularly in some of the Indigenous people who have been infected recently, and that has been incredibly tragic. We've had a number of people in their 30s who have died in the last few weeks from COVID. So it's a combination that we're seeing now, and it's why it's so important for us not to lose sight of this is still circulating in our community. And while we know that your risk goes up dramatically after age 70, everybody is not immune to this virus, and it can cause severe illness. We've seen hospitalizations in young people, and we've seen, sadly and tragically, deaths in young people, particularly in the last few weeks.
Next question is from Lisa Houston, News 1130.
Hi there. Dr. Henry, I'm wondering if I could just first touch on what you just talked about of the tragedy of a number of people in their 30s dying recently. I'm wondering if you can talk a little bit more detail, obviously the limited detail that you can give about it, but also does this portend of a change in the virus that younger people are seeing more severe illnesses?
The second question first, not that we are aware of. We have not had anybody who has died from one of the variants of concern, for example. There's still some question about whether or how much the UK variant in particular leads to more severe illness over and above just when more people are infected. Your probability of somebody who has underlying illness or has ends up with severe illness gets infected as well. What we have seen, sadly, is deaths in now 3 young people in their 30s, some with underlying illnesses, and some who were Indigenous people and related to some of the outbreaks that we're seeing. So this is why we're paying so much attention to making sure that we can try and protect people, provide them with isolation, support them in their health needs as well if they get infected. Even young people can have severe illness, particularly if you have other underlying conditions as well. It's not, as far as we can tell, related to any changes in the virus. It's more the conditions and the community transmission that we're seeing in some communities.
Lisa, do you have a follow-up?
I do. We've been running a story. There was a video out recently where an anti-masker, anti-virus, anti-everything, was saying some pretty terrifying things about you and suggesting that some harm should come to you. And I know that you've been dealing with a number of threats and have had to call in security. I'm just wondering if you can talk to where you're at with that, how you're dealing with that, if it's increased, decreased, and just if you can talk to that outrageousness that's happening because of your position.
This is one of the things that has been incredibly challenging. We have people who have been protesting outside our office, and it affects me, but it also affects my family. It affects the people we work with, and that's the part that I find hardest to deal with. We have a very strong support system, and I know my colleagues across the country have all been facing some similar challenges. We meet regularly, and we do support each other in that, and I think that's important. I recognize that when people are in crises, part of the way they respond or react is to lash out, to become angry. That is a reaction that is sometimes fed by certain groups, by certain media, social media posts, etc. And it's not to condone it, but it's to recognize that the psychology of some people the psychology of what we're dealing with leads some people to react that way. And I do believe that it is our collective support for each other that helps mitigate the impacts of these things. Having said that, I do have security. I have a security system at my house. I have ways that I make sure that I check in with people. We support each other. And it really is not acceptable. And what I find most disturbing is how it impacts the people I work with and my family and my close contacts and their concerns. So that's the most challenging piece right now.
We live in a democratic society, and it is absolutely legitimate to disagree, even about issues such as the pandemic. But some of the disagreement is totally unacceptable. Dr. Bonnie Henry is an extraordinary leader, and that doesn't mean she's right all the time. Certainly doesn't mean I'm right all the time. Doesn't mean the government's right all the time, or everyone's right all the time, the federal government, World Health Organization, or anyone else. But the kind of personal attacks of some of them are just completely unacceptable. And I just want to say, because I have the opportunity to meet with Dr. Henry every day, how she never loses sight of people in this pandemic, how regardless of the criticism, she continues to show compassion for everybody, every single person. In regards to one's view of what we're doing from a day-to-day basis, that is worthy of respect for an extraordinary human being in our province. And I think we need to have a slightly more respectful debate. I always try, to the best of my ability, to model that personally. I think we have to find ways in our society. There are unacceptable comments like the ones you referred to, disgraceful comments, and I condemn them utterly. But all of us have to find ways to disagree without personal attack, because I can tell you this, that all of our medical health officers, our deputy ministers, our healthcare workers are giving everything they have, not 5 days a week, but 7 days a week to this pandemic, and have since it began for us, which was more than a year ago, in January of 2020. And I think Dr. Henry and all of our healthcare workers deserve recognition at 7 o'clock, at 8 o'clock, and 9 o'clock for all they have given to all of us during the pandemic.
Next question is from Richard Sussman, Global News.
With March break around the corner now as we approach March, what's your advice, Dr. Henry, for those people who are looking to book vacations? Let's focus first within the province and outside of the province, but within Canada. What is the recommendation around spring break?
You know, we are well aware that spring break is coming, and I know there are many families and students and people in our education system that are really looking forward to that break. We are having talks, and I say we, talks across my colleagues in public health and in education and across the ministries about, you know, how can we support particularly young people to have safe opportunities to make up some of the challenges that they've been faced with. And, you know, I've said all along how struck I am by how challenging this pandemic has been for young people, for especially, you know, our teenagers and young adults, but also all the children who are seeing a strange new world. So we are working on some strategies for helping make March break a special occasion for young people. In terms of travel, right now, as always, we need to stay local, and we're going to be reassessing things as we move through the next weeks, and we'll be talking more about March break and what we need to do in the coming days. But think small, think local.
Richard, do you have a follow-up? Richard, are you there?
I am here. Sorry
ahead.
about that. I just want to just make sure that it's clear to people that right now they should not be booking spring break. And you can hit on that. I just also need to ask about your comments made earlier this week before committee around reforming the Police Act. The RCMP union, as I'm sure you are aware, has come back and expressed concerns saying that you know, what your comments were uninformed and inaccurate. Do you have a response to the RCMP union about the concerns that they have raised about your comments before committee?
In terms of March break, you know, it is coming up in the coming weeks. We may be in a different position then, but my advice is to think local. And in terms of the RCMP, I have to say that I was taken aback by the misinterpretation that got out in that letter. I do absolutely regret that my submission to the Police Act Special Committee, which is what it was, it's a Police Act Special Committee looking at reforming the Police Act. And, you know, it was my intent to provide examples that from my experience of how health and the police at the front lines have been working together. And I provided some examples that showed that the Police Act in its current state doesn't really contemplate the complex social issues that police officers on the front line are addressing every single day. And there was absolutely no criticism at all of anything that frontline police officers were doing, and the misinterpretation of that is something that I regret. But in my submission, I was referring to an example of the complexity of policing in British Columbia and of the challenges that on-the-ground officers face. And the example I used was and when they initially were rolling out naloxone in our communities, and this was in response to the overdose crises, there was concern from police services, and there was conflicting messages that came down from police services in BC versus RCMP. And this was an example of how the frontline police officers were put in impossible positions that challenged them. And my advice to the special committee was that they consider some of these complexities and that they reform the Act to ensure it enables us to work together closely, because we know that that's what works and it supports people. And I think that, the Police Act didn't contemplate some of the complex social issues that police are facing every day on the front lines, and I recognized that in my submission, and we talked about that, and we talked about the need to provide them with the resources to support working together to help address, particularly in the context was in the context of substance use and mental health issues that police services are faced with every day, and their vital and important role in public safety in our province. So I'm not sure how that got interpreted into my disparaging in any way police officers on the front line. It was to ask the Commission to look at how they can reform the Act to make sure that we could address some of these complex issues that police are faced with.
We have time for one more question this afternoon, and for everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Joel Ballard, CBC.
Hello, thank you for taking my question. You mentioned key indicators that are on the uptick right now, like the 7-day moving average, and we have the reproductive rate. If you're monitoring these indicators to see when it's time to ease restrictions, what happens if they don't go down? At what point will we be talking about increasing restrictions? And can you also answer that, or can Minister Dix answer that in French, please?
So all along, we've been monitoring. These are some of the key parameters that help us understand where we are in the course of this pandemic in BC. So we are holding our line right now. We've seen a slight uptick. What I have been concerned about, and what we've seen in other countries, is that when variants of concern start building, that we can see rapid takeoff and rapid growth. And then we would need to consider, is there other ways that we need to, other measures we need to take to stop those situations where transmission is happening. And that's why we've been paying attention to workplaces, why we're working with WorkSafe BC to get out there into workplaces, why you've seen some of the measures we've been taking in places like Big White and Whistler to address the transmission events that are happening there, paying attention to places that aren't following adequate safety plans so that we can prevent that from happening. And what we would like to see is that we have things under control. The other important piece from our perspective is, do we have the public health capacity to follow up on cases, to find those chains of transmission, and to take the necessary actions to support people to isolate effectively? And that is something that was stretched quite a lot in November, particularly in the north, in the interior recently, and of course in Fraser Health. So those are parameters that we need to keep in balance. We have tried all along here in BC to keep as much open as we can safely. And so keeping that balance means making sure we're following the safety plans, making sure we're not making those exceptions for ourselves that lead to increased risk. And we talked last week about the event at a pub that was led to over 300 people being affected, including a transmission in a daycare, transmission in a school, transmission in a number of other workplaces, and in families. So these are the things that the chains of transmission we need to stop as soon as we can, and that's why we pay attention to not only the overall numbers and how they're moving, but numbers in different communities and where those transmission events are happening.
Effectivement, on suit l'évidence tous les jours, quotidiennement, pour faire des changements nécessaires. Il se peut qu'on soit en mesure de considérer une réduction de mesures, mais pas maintenant, pas pour aujourd'hui. pendant la période des vacances du printemps. Il faut rester dans nos propres... On considérait le durcissement chaque jour et d'assurer qu'on peut ouvrir autant qu'on peut tous les jours, et on va considérer à le faire. On a vu depuis quelques semaines, depuis 2 semaines, le taux de transmission dans les régions de santé de la région de Vancouver, une augmentation nette, pas sévère mais nette et claire. Et dans la région de l'intérieur et sur l'île de Vancouver, surtout dans l'intérieur, une diminution des taux de transmission. Donc on fait ça, on considérera ça tous les jours, et il se peut qu'on puisse faire soit une ouverture, soit des fermetures si l'évidence change. Et ça, c'est notre attitude depuis le commencement. Mais il faut dire que les mesures, chaque mesure a un prix à payer, n'est-ce pas? Donc il faut prendre ces décisions avec clarté, mais il faut aussi avec une certaine réticence. Il faut prendre les mesures nécessaires, mais avec toute une compréhension des effets négatifs d'une telle mesure. Donc, ça, c'est notre situation actuellement, et ça va continuer pour les semaines à venir.
Joel, do you have a follow-up?
Yes, please. BC Parks has opened its reservation systems. That happened Monday for camping trips. The public response, we know, last year was huge, but considering that health orders still restrict travel within BC, are we confident that people will be able to travel to these camping spots, even if they're outside of their region, by May?
I'm hopeful, cautiously optimistic. You know, I think we need to start planning for our post-COVID lives. Obviously, we are learning as we go every week, every day with this virus, this pandemic. And we are learning a lot more information about how effective vaccines are, how we can stretch and provide immunization to protect more people in the coming months. So that's a really important part of looking forward. And we also know that at least we've learned, there seems to be a seasonality to the virus and its transmission. So I am very hopeful that we'll be able to go camping, at least in BC, and that we'll be able to experience our province in that great way. So yeah, I think this is a time to start thinking about that. Not to go just yet, but you know, it's a time to prepare. I think we are going to have, you know, with our immunization program coming, if we can keep our numbers down and prevent those rapid increase in growth in the next few weeks, we're going to be through a really dark winter, and we'll be looking to spring to be able to have some of those really important social connections back together again. Thank you very much.
I think they're gone. Thank you very much, and I'll see you Monday morning.